we are going to consider the clinical interview, the process of assessment from Chapter 3. This is a most important part of your work with clients. It involves your first experiences of them, and you're getting a correct picture of their situation in life. And so we begin with, there's the beginning, working stage, and ending stage, as we would see in terms of your working with clients over time, and we'll begin with the beginning stage. This is your opportunity to collect data regarding the client and developing the psychosocial assessment or summary, which is critical in terms of clarifying the diagnostic issues of the client and other elements that are going on in the client's environment. So certainly the beginning of this is the establishment of rapport with the client, how you greet the client, how you have the client sense of comfort in your setting, and an openness to allow the client to speak whatever the client wishes to share. This is an important element of any kind of work we do with clients, the focus on intensely listening to what the client has to say and making sure that we understand what the client is saying. That's certainly a critical element of beginning work. So in your first meeting, you may want to, previously, when you talk to the client prior to coming, determine who should attend the meeting. Will the client come alone? Will they come like with a parent if they're adolescents or children? Will they come with a spouse if there's an issue related to that? In other words, being careful, of course, in domestic violence situations, not to be seeing the spouse and the client at the same time. But anyway, trying to establish who is coming, and then and so who does the client come with, essentially, to your interview? And then what is the theoretical framework you will use with this client? You all have done your theory course already and have ideas about what your approach will be, but is your approach the most appropriate given the client's circumstances, or will you need to move towards a framework based on the context of your practice? Like in the jail setting, I tend to be an existentialist in my approach, but quite simply, people in jail tend to be more into cognitive behavioral approaches to working with them, and so I had to shift in terms of the context to working from a different perspective, a different theoretical framework, in order to have the clients experiencing some levels of success if they weren't psychopaths, perhaps, because psychopathy goes well into midlife before things seem to be shifting for a lot of those individuals. Some people contend it has to do with the development of the brain over the life course, but earlier on, the precursor to psychopathy is the conduct disorder that people have prior to the adult diagnosis. But anyway, in the process of your initial interview, asking a lot of open-ended questions and intently listening, I think, would be certainly key ideas in terms of your work. And then also being aware of your, self-awareness. In other words, how are you responding to the client emotionally and psychologically? Does anything stand out to you, such as race, gender, sexual orientation, spirituality, or social class? Do any of these have some sort of negative resonance within you that you need to attend to as well, to reduce bias perhaps in terms of your working with the individual? Next, we move towards, in this process, the introduction in your initial session. Again, introduce yourself using your full name and how you want to be addressed, and ask the client how the client would like to be addressed by you in your sessions. For instance, refrain from such questions as, what is your preferred pronoun? Most clients aren't going to have a hunch what you mean by that, and it would be better to ask how people would like to be addressed. That's a more direct and clear question to all clients that may come into your office. And again, there's an importance of being on time for your session with the client and encouraging the client to be on time as well. And also pay attention to the seating in your office. While assessing individuals, it's perhaps best to move away from the back of your desk and sit on a chair outside of that environment, so there's not a block between you and the client. And also, always make sure in setting up your office that you have a way of escape from the office. If someone becomes violent with you, you don't want to be up against the back wall. You'd rather be closer to exiting out the door. So try to always be attending to where you are in the office in proximity to clients, particularly if there's a chance of any kind of violence, which a lot of times we can't predict. So I think it's best just to keep that in mind when you arrange your office. And then simply asking the client such simple questions as what brings you here today, or what is on your mind today, as kind of the opening to the sessions that you work with them. Again, ask questions about the client's symptoms. How long have they had? How long have they gone on? You might ask what was happening around the time the symptoms started, trying to get some sort of clearer picture of what's happening and how the environment is impacting the client. And then also be sure in your session, the initial session, to look at the client's resources, emotional, financial, otherwise, and what the coping capacities are in reference to the current situation. Are there other times in life where the client had experiencing something similar, and what did they do in order to get beyond that? Again, this is looking at the strengths and challenges perspective that is characteristic of social work. Also, during the initial session, you want to look at boundary setting and be very clear about the limits of confidentiality. Inform the client that if they share something with you that suggests they're going to harm self or others, you're bound by the law to report this information. And there's an interesting statement on page 31 in chapter 3 that I think may be something that most of you would find helpful in your initial session. It's sort of like a stock statement. For instance, I am a student or an intern training to be a social worker. I will be working at this agency until May. My work with you will be supervised by a licensed clinical social worker. If you have any questions about this, I would be happy to discuss it with them or with you. So that way they clearly know that you're under supervision. And as a registered social worker intern, you will need to let clients know that you're being supervised by an LCSW for the purpose of licensure. So keep that in mind. And then, the clients will a lot of times ask personal questions, and that's a judgment you have to make as to how much you're going to disclose to them. Certainly, you don't want to be giving clients your home phone number or allowing off-time access to your private life. That's certainly a no-no. And then the therapeutic relationship. We've talked about transference and countertransference in the theories course, and so you're aware of that. But there's a new term that comes into this semester, which they call, on page 31, cultural countertransference, which is defined as a complex and interacting set of culturally derived personal life values, academically based theoretical and practice beliefs, emotionally driven about ethnic groups, and feelings about your own ethnic self-identity. So being aware of cultural elements when dealing with clients that may be different from your perspective, and attempting to be open to understanding and going out and learning more information if it's something that you have as a gap in your knowledge. And then in terms of establishing the working alliance, the critical piece is the establishment of rapport at the outset, and focusing with clients in the session on the here and now. Again, that's sort of like a Gestalt approach, which we saw Pearl's in his work with Gloria. And then you'll always have elements of resistance in working with clients. And so, this is an opportunity for you to utilize some of the motivational interviewing techniques, such as rolling with resistance, or the other ones that were talked about earlier, either in this semester or during your theories class. The next element that the author talks about in chapter 3 are the Transtheoretical model stages of change, which have been around for a long time. But as you see here, they're broken out. Pre-contemplation is the stage where the person is not considering change. Moving towards contemplation, where the person considers change, but needs to work on getting there. And then the preparation or determination phase, where the client begins to look at the change and planning when they might attempt to start changing. And so you want people to begin to make small steps towards the change, so 0 to 3 months as it says here, and then actually begin to do the changed behaviors in the doing it action phase. And then, of course, maintenance. And this stage is continued a commitment to the new behaviors and rewards and supports and reinforcement that you want to emphasize with them as you're working with them. And then there's always the opportunity for people to relapse and then kind of beginning the phases over again or re-entering one of the phases, whether it be pre-contemplation, preparation. A lot of times the relapse may lead back into the preparation and action because you want to review what may have been missed there that reinforces and supports the person in their efforts. The next area we'll look at is the beginning stage of working with clients. Here we have the pre-contemplation phase that would fit into this stage. And basically, a lot of times this is characterized by resistance, indifference, and anger. A lot of times we receive people into practice, who are not wanting to be there, so they're resistant. So that you have to work with. And again, techniques of motivational interviewing can be beneficial in these initial stages with court-mandated clients. But here the therapist would validate the client's lack of readiness, but encourage the client to reevaluate and raise their consciousness about the situation that they've come to you for, and doing some self-exploration. Again, it's important to intensely listen, providing feedback and clarification, because the client needs to have a sound sense that you really are listening to them intently. And then follow up and connect with the client, connect the client to the next session, so that you want to summarize what happened in the current session and talk about what you and the client will be working on in the next period, which leads to the deliberate practice aspect of your work here, because between sessions you're going to, in terms of deliberate practice, reflect on what happened in the session and begin to develop and complete the intervention plan by the second time you see the client. And so here we have, for example, intervention planning. And Dan, I think in Chapter 3, is a good example of a case that the author used, so I'm going to use him as we go through this process. So in terms of this deliberate between-session practice, the therapist determined that the primary issue here was mistreatment of a parental figure, which was the mother who abused him at an early age. And then the theory to conceptualize the intervention, she chose object relations perspective. You know, we talked about object relations in theories, and it really does fit this particular client, because it involves elements of the mother, as you remember from the theorist's discussion. And then, you know, what is the working hypothesis with this client? So you want to use these kind of frames when you're working yourself with clients. I made these up, this list here, but I think it's helpful. There's a primary issue, then there's what theory you're going to use to develop the intervention, and then what is your working hypothesis. In this case, Dan was trying to master abuse experienced by his mother, and he provoked authority figures who appeared to disrespect him with the intent to harm them, so he would feel empowered and triumph over them. So, again, not going in a particularly positive direction to get beyond this in terms of working through, but that was his approach to working with authority figures and how they brought about a sense of transference that he experienced. And then the practice model that she used was this transtheoretical stages of change model, which we just reviewed in the previous slide. Moving on to the middle phase of work with the client. You'll notice that in the first stage you had pre-contemplation, but the middle stage, which is the working stage of the process, there's contemplation, preparation, and action. So a number of these transtheoretical stages work during the middle phase of the client's encounters with you. And basically, contemplation is where the person may experience ambivalence to change, and the therapist asks questions that will clarify their ambivalence, help them reflect on their situation and what the ambivalence has to do with, emphasize and provide warmth and encouragement at the contemplation stage, because this helps provide a groundwork on the path towards leading to the preparation. Here, in preparation, the client begins to plan for change and suggests a time frame in which they might change, like 0 to 3 months. But here, the therapist and client are concerned with problem solving, identifying obstacles to progress towards the goals. An action plan with small sequential steps towards the goal is important to be established here, where the person begins to visualize what the change will look like. It's almost like the miracle question and solution-focused work. And then discussing the need for social support. What are the current social supports the client has in their lives, and what social supports might be instituted that would help the client reach the goal that they're working with you on. And then, of course, the action in the middle phase. The action is the sort of end of that part of the road, and it's a behavioral change. So here the client begins to modify their behavior, and the therapist encourages, promotes self-efficacy, and focuses on social support that help the client reach his or her change in behavior. And again, the middle phase, with particular client we're looking at, Dan. In the contemplation stage, the therapist introduces stress reduction techniques for Dan, such as things that help him relax, and developing an ongoing awareness of triggers that lead to his negative behavior. For instance, she used warmth, empathy, and clarification during contemplation to help move Dan along. Dan began to see that he had some responsibility for his problem during this period. He gained an awareness that his feelings began very early in life with his mother's abuse, and he was allowed to ventilate his anger about this. And then he developed self-statements he could use when he felt criticized. So she helped him develop these affirmations, you might call them. And his acceptance of behavioral techniques, which he was practicing, informed the therapist that he was ready to move into the preparation stage. So in other words, he was actually working with her in developing his alternatives to his current way of approaching things in his experience. This moved then to the preparation stage, where the therapist arranged for the school to assign Dan to classes where experienced teachers were going to be in the classroom and would be less likely to trigger these negative power plays with authority figures. The therapist reinforces Dan's impulse control by appealing to his intellectual strengths. He began to talk about his abuse more openly. And his mother contacted him about 3 weeks, contacted him 3 years after her last exchange with him, and he was enraged but considered a possible reconciliation, and his demand was that she apologize to him for what she had done. This then links into the action phase, because that's where he was going when Mom showed up. And at this point, it's interesting when we work with clients, this element of synchronicity, which Freud talks about the term synchronicity, but there are these interesting events that happen that are not planned, but that seem to be affecting the work we have with clients. I had a similar situation with a client a few years ago that I was supervising a person for licensure who had a client that we were doing some images with in terms of mandala art. He would draw pictures, and one of them had to do with his father and him, which was what he was trying to do at the time. He decided he wanted to work on forgiveness with the father. And in the middle of the sessions, when we developed this several stage process of helping people work through this, when he got to the point where he was writing a letter to the father and was going to, in the next session with the therapist, read the letter and engage in sort of an empty chair dialogue, the father calls him out of the blue in the midweek and asks him to come home because he's dying and wants him to take over the farm. Now, his father hadn't talked to him in 5 years, and he had moved away from home because he was gay, and that wasn't an acceptable thing to be in the Midwest. And so his father and him had crossed a relationship for years, because once he wanted to become an equestrian Olympic competitor, and his father told him he couldn't ride a horse, and so he sort of smashed his dreams. And anyway, it's interesting that at certain times when we were working with people, they are contacted by individuals who have a significant effect on what they're working on. In this case, Dan's mother called and started to stir up a whole bunch of previously experienced trauma for him. And so as he moved into the preparation, the action stage, his sessions were reduced to 2 times a month because of the insurance that he was under with his father's company. And he began to act out again at school, most likely in response to his intense dealing with his mother coming back into his life. Additionally, the insurance company was not going to cover his therapy and was a financial burden to his father, so this provided several elements here when it was an important change point for him. Numbers of things came up that were possibly obstructive, or I like the idea of crisis in terms of the Chinese characters for crisis: danger and opportunity. Here we had a lot of danger involved, but there was a lot of opportunity as well to begin to move forward and deal with these issues, because Mom was back into the environment and was certainly an element that he could work with effectively with the therapist. And then, and as well, there was attempt on the therapist's part to build social support, since there was a group of divorced children from divorced families that was developing a school that she referred him to, and so we moved then from this action stage, which has gotten a bit shaky, toward the ending phase. And now, just generally about ending phase, I'll talk about his experience of ending in the next slide, but currently, sessions often end without meeting the goals that were initially stated by the therapist and or agreed to by the therapist and the client. And a lot of times, termination can either be planned or unplanned. And as we work with individuals, from time to time, they just stop coming. So there's a lot of ending kinds of issues that come up when working with clients. And workers need to let go when there's a clear parameters to treatment. So in other words, when treatment ends, not continuing to have the client contact them or ask or to give their home phone. These would be unethical practices. Termination is termination in a sense, unless sometime down the road the client may come back for other work. But in terms of the current period, it's best to review with the client what they have accomplished during this period with the therapist and point to the next step in terms of them being able to work this out on their own, having made the change in their approach. And again, the importance here, though, is certainly of reviewing clients' successes and movement towards their goals. And in the ending phase interactions with Dan, unfortunately, the therapy came to an abrupt end when the insurance ceased to cover the sessions. And so the concerns here were that he may be re-traumatized with feelings of abandonment from the therapist because out of her control he was no longer going to be seen. But again, it was another issue of a termination that was somewhat possibly problematic. So she reviewed with Dan his progress in coping and addressing anger management issues and encouraged him to continue working with those and let him know that the door was open if he wanted to see her again at a later time. So these are kinds of the stages of working with the client, and I encourage you to kind of review the chapter rather closely and take from it some of the high points that I've pointed out here that will assist you in your work, both this semester in your practice, but also in your employment